Hello, I'm Dr. Jim Bodfish. I'm a professor in the Department of Psychiatry and Pediatrics here at the University of North Carolina at Chapel Hill, and I'm going to be speaking to you about the research updates in the area of repetitive behaviors and problem behaviors in autism. And when I think about these areas, these areas of research, I think about three questions. One, should we be treating repetitive behaviors? And the second is, when should we treat repetitive behaviors? And the third is, how should we be treating repetitive behaviors? So thinking about the latest research in those areas, we can think about some behavioral studies that have shown us that there's really a large variety of repetitive behaviors in autism. So we used to think that this was just simple things like motor movements, hand flapping, and body rocking. And now we know that there are many other types, like rituals and sameness, and circumscribed interests, preoccupations, and attachments. And it's these other types that are probably more interfering and probably more in need of treatment. We can think about studies of parents and families that are recent studies in this area that have shown us that of all the features of autism that parents have to deal with on a daily basis, these ritualistic and circumscribed interest kinds of behaviors, repetitive behaviors, are some of the most distressing and difficult, often because they require a great deal of accommodation. And so that would be another reason that we would want to treat that. We also know from studies of problem behaviors in autism that there can be a link between repetitive behaviors and problem behaviors. So another reason to treat that. And then a large area of growth and research has been studies of early development in autism, and there have been very exciting findings that have shown us that the presence of repetitive behaviors at the age of 2 strongly predicts the severity of autism later on as an adolescent. So that indicates that there's a potential for early intervention for repetitive behaviors that could impact the total picture of autism severity later on. Another question then would be, when would we treat repetitive behaviors? So 10 or 15 years ago, it was thought that repetitive behaviors maybe aren't that important in terms of treatment, maybe and that they occur later. And now we know from very exciting studies of infants and toddlers with autism that we see these features, all of the features that I described in terms of repetitive behaviors, quite early, potentially as early as 12 months, 18 months in infants that will later go on to be diagnosed as autism. So in terms of interventions and implications for teachers, this suggests the opportunity for very early intervention for repetitive behaviors. The last area then is, so if we should treat them and we should treat them early, then what do we know about methods to treat repetitive behaviors? And we don't have enough treatment studies in the area of autism, but what we have had over the last 5 years is a very nice consensus in terms of what we do have in terms of evidence base that we could use to guide practice. So what practices we know that teachers could think about would be effective to treat repetitive behaviors and problem behaviors in children with autism. So thinking about the evidence base of practices to treat repetitive behaviors, we can think about what techniques that are used that we really don't have evidence for. That's sort of the first question. And so often techniques in the area of things like sensory integration or diet are used, and these can be costly and sometimes very stressful for families. And at this point, we still don't have the right kind of evidence that we need that suggests that those treatments, those approaches are effective in treating repetitive behaviors and problem behaviors. So part of what we have here is we know what we shouldn't be doing. And the second part of that question is, what does the evidence base tell us about what practices that we should be using? And the research is kind of teaching us that there's two broad areas in terms of interventions for repetitive behaviors. The first is evidence-based techniques in the area of behavioral or educational techniques. And here we know from literature in applied behavior analysis, literature in the area of positive behavior support, that evidence-based techniques that involve rigorously teaching, effectively teaching appropriate skills, social skills, language skills, play skills, that the more effective that teaching, the less repetitive behaviors and problem behaviors that we see. So that's one very important area in terms of evidence-based practice. We're also seeing some emerging evidence for treatments that come out of the behavior therapy or cognitive behavior therapy literature. So this is borrowing techniques from other disorders that have very prominent repetitive behaviors, like obsessive compulsive disorder. So we're beginning to learn about therapies that would be effective there. And then the last area in terms of evidence-based practice that we know for repetitive behaviors and problem behaviors is the area of specific psychotropic medications, psychiatric medications that we know are effective for treating repetitive behaviors. And here the practice is to find very specific co-occurring conditions like irritability, hyperactivity, mood problems, obsessive compulsive disorder, and keying specific medications to those. So those are the techniques that we know that the evidence base supports for the treatment of repetitive behaviors.